Every year, around 35,000 children and adolescents in Europe are diagnosed with cancer. Today, about 80% of these children survive. But when the cancer comes back, survival chances can drop dramatically. This is the case for neuroblastoma, one of the most aggressive childhood cancers. Because neuroblastoma is rare, international collaboration between researchers is essential to improve diagnosis and treatment. To give children the best treatment options, it is important to closely monitor their disease and detect a potential return of the cancer as early as possible. But how can we detect relapse earlier without putting children through stressful, invasive tests? Lisa, diagnosed with neuroblastoma at the age of 3, was considered cured. Like any parent, Lisa's family dreams of a normal life, but the fear of relapse lingers. Every 3 to 6 months, Lisa undergoes scans and a bone marrow test, an invasive and anxiety-inducing process, which is a burden for Lisa and her family. What if the cancer returns, but they don't know until the next checkup 6 months from now? Is there no other way of monitoring Lisa's cancer? Then, Lisa's doctor introduces a new possibility: liquid biopsy. This method, essentially a blood test, can even be done at home, allowing for more frequent monitoring without the burden of the stressful and invasive tests. In the lab, the blood is analysed for small traces of tumour DNA, or mRNA, genetic material released by tumour cells. If detected, it may indicate the cancer is coming back earlier than the scans and bone marrow tests would have shown it. The European Union-funded project MONALISA, launched in 2024, is stepping forward into making this a reality to all children with relapsed neuroblastoma and beyond. If these blood tests can be analysed directly in hospital labs and at any moment without needing stressful tests, a diagnosis can be reached sooner. Lisa's parents are of course anxious to know the results. MONALISA is also collecting information about the emotional stress that patients and families experience, helping hospitals to better understand the psychological impact of frequent disease monitoring. This project includes a clinical trial with 150 patients across 11 European countries, with 24 partners from clinical research centres, diagnostic labs, private companies, and patient advocacy groups. MONALISA is helping to bring liquid biopsies into standard care, ultimately aiming to improve the overall survival rates of neuroblastoma patients. MONALISA, the future of cancer monitoring starts now. For more information, visit the MONALISA website.